Welcome back, everyone. We seem to have resolved the minor technical problem. Is everyone still with us? You know, a minute. Yep. So thank you. We're now moving on for the purposes of the public. We were recording the bit that was not streamed, so it will be available. It's not that it's been totally lost to public viewing. So we're on to agenda item 6, the overview of the local oversight arrangements. And I think we're with you, Suzanne, here in the room.
Thank you, Chair, and welcome this morning, colleagues. This report provides an overview of local arrangements relevant to the Health and Social Care Partnership, and it's intended to provide assurance to committee of these arrangements. There are updates on the work of 9 management groups and committees, and this includes the Public Protection Chief Officer Group and their most recent meeting on the 21st of June. Section 5 provides an update on the NHS Forth Valley Clinical Governance Committee and summarises the papers that they have considered at the meetings on the 23rd of May and the 1st of August this year. The NHS Clinical Governance Working Group meeting papers for the 11th of May and 6th of July are also summarised in the report. To note, the Adult Protection Committee are reviewing the local adult support and protection large-scale investigation practice, and this has been mapped against the new national framework, which was published in June last year. This is focused on part 1 of the framework, and it's identified that practice largely aligns with some areas identified where we're more advanced in practice and some areas for improvement. And these areas will be taken forward and overseen by the Adult Protection Committee. An update on the Alcohol and Drug Partnership is included at section 8, with a report also being presented to the IGB next week on a range of issues affecting the group. I'm pleased to note that the Strategic Prevention Coordinator for Suicide and Substance Use Death is in post and is in attendance today if there are any specific questions. But we've also included an update of the ongoing work that's been happening at section 9. And you'll note from the report that the publication of drug-related deaths has now been out, and it's showing a decrease from previous years. And to assure the committee that the multi-agency review process for drug-related deaths continues and an update is provided. The work of the Health and Social Care Partnership Clinical and Care Governance Management Group is included and notes the scrutiny and assurance work around external reports and learning from feedback. And this is ongoing and supported by the 3 chief nurses who are leading a cross-system learning event with a focus around areas such as a lack of or delay in receiving discharge letters, medication issues, or poor or lack of communication. And finally, we've included an update on the Health and Social Care Partnership Health and Safety Management Group, and its meetings on the 27th of June and the 6th of August are also included. So in conclusion, the board is asked to consider and comment on the result and happy to take any questions. And I've got a number of colleagues in attendance here today if there are any specific questions around the work of those groups. Thank you.
Okay, thank you, Suzanne. Thank you for this very useful update report. Does anyone have anything they want to add, given that there are a number of colleagues with specific areas? Or does anyone have any questions or comments? I'm sorry, yes, Roger.
Thanks, Chair. Suzanne, in terms of section 9.18, it says a draft of this document will be developed. Any timescales for that, do you know?
I'm not sure of timescales, and I don't know if it's maybe a bit early for Stacey in the role to sort of coming around that. So this was a bit of a highlight report. Sorry, it's an output from the highlighted activity around adverse deaths in Oversight and Planning Group. I'm not sure, Stacey, or if that's something we can take away and come back to you, Roger, with our response.
Does Stacey have anything you want to add to that?
Good morning, everyone. Hi there. My camera doesn't seem to be working for some reason this morning, so apologies for that. But yes, my name's Stacey McIntosh and I'm the new Strategic Prevention Coordinator for Suicide and Substance Use Deaths, as Suzanne mentioned. The only thing that I would really highlight around that is that the Adverse Deaths Oversight and Planning Group. We had hoped that that would have met by now, but unfortunately the public health consultant who was due to chair that meeting has just recently left post, so there will be some discussions with public health in terms of identifying a new chair and taking that forward.
Thank you, Stacey, and welcome.
Thank you.
Sorry for putting you on the spot so early in your new post. And I'm going to put you on the spot again. Looking at the suspected drug-related deaths, there is quite a significant reduction at the moment. And I think it would be useful if we could have some comment on that, because one part of me wants to say, this looks really positive and how have we managed to achieve that, but well done. There's another bit of me worries that it may not be something that we can sustain. I wonder if you'll be able to say something more about that.
Yes, absolutely. So we know from the published data, as you say, that there was a Forth Valley-wide reduction of 11.6%. Sorry, 31.9% for drug-related deaths specifically, but 39.6% for Falkirk. So that is quite a substantial increase and obviously a very welcome reduction, but I suppose it's not reported with any complacency given sort of UK and European figures in terms of where we sit within that. So the review process that we have in place at the moment is a very robust multi-agency process, and we extract as much learning from that as we can, and we use the Pentana risk management system to sort of look at theming and collating actions that we can take forward. The data does look at sort of year-on-year variations. It does account for that and tends to sort of provide 5-year overviews so that you can see whether there is a steady reduction or whether there are any outliers within that as well. So that's also something that we take into account. But I suppose the only other thing that I would pull into that is that this death by suicide data that was also published very recently, there was an 11.6% reduction across Forth Valley, but a 24% reduction in Falkirk. So we know that there is a significant reduction across Falkirk in adverse death types, which we know are often linked. So there is lots of work going on around sort of both of those areas.
Thank you, Stacey. And once you've had time to get yourself more settled in the post, I'll look forward to meeting you and having further discussions about this. The other thing that I just wanted to raise was the reviewing of the structure of the ADP. And sorry?
It's Martin.
Yes, I was going to come to you, Martin, if that's okay, if you could say a wee bit more about how that's progressing.
There's actually a report due at the IGIB next week to highlight the proposals, but it's actually moving from the current model, which is in reality an information sharing forum, to a more structured forum that actually makes decisions around commissioning and will scrutinise services more. So there will be more detail coming to the board in the future. I guess just picking up on the points from the last comment, the ADP is planning to run another event focusing on drug-related deaths and the work of the ADP, similar to the event we held last year, where it was an open forum for members to come along, ask questions, meet the lead officers, and actually get a bit more detail around the work of the ADP at that point. But in terms of the group structure and the representation, as I said, there is a report coming to the next IGB to really set out the model for the future and actually seek permission for that moving forward. So you will get a lot more information shortly. Thanks.
Thank you very much, Martin. That'll be the IGB next week. Yes. Yeah. I'll look forward to asking more questions then. Anyone else got any questions or comments? If not, Can we just agree that we have considered and commented on the contents of the report? Thank you. So we'll now go on to agenda item 7, the inspection reports. And I think we have Patricia to speak to that, first of all, and possibly Gail as well.
Good morning. Yep, I'll introduce the paper and I'll hand over to my colleague Gail Woodcock. This report is the regular report that members of the committee receive, providing an overview of inspection reports of the registered health and social care partnership services, and also the Mental Welfare Commission inspections are included in this as well. The report also provides an update on the current escalation of NHS Forth Valley, and the most recent escalation report that went to the escalation board on the 25th of July is attached as an appendix. You'll see within section 4, section 4.24, the recent inspections by the mental welfare, or visits by the Mental Welfare Commission to wards 2, 3 and 4 within Forth Valley Royal are outlined there, with the recommendations for improvement for each of the wards detailed at 4.24, 4.28 and 4.31. In relation to other services within the partnership at section 4.3, just to draw your attention to the recent care inspection of the local community residential resource housing support service within NHS Forth Valley. This is a service for people with learning disability, and you'll see at section 4.3 the excellent quality indicators that the way they've been assessed as excellent. Excellent is the grade 6 rating of the inspection process, which is deemed to be sector leading. And you will see that that service has been assessed in relation to how well it supports people's well-being and how good the leadership is, and all elements of that have been deemed to be sector leading. So delighted to be able to highlight that to you, some of the good work, excellent work that's going on to sustain that level of performance and excellent provision of care within that setting. I'm going to hand over to Gail, who will take you through some of the council run recent inspection reports. Thank you.
Thank you, Patricia. Yes, Gail.
Thanks, Patricia. Thanks, Chair. Yes, so we've had a number of inspections of our council services relatively recently, as set out in the report, including our care homes. We had inspections of Cunningham House Care Home and Burnbrae Care Home earlier in the summer, and we're really pleased with findings of the inspections. They were all graded as good or very good for all of the indicators, which is really, we're really pleased about. We've also, I wanted to update the committee. 2 weeks ago, we had further inspections of 3 of our internal care homes, and the dates of those inspections didn't allow us for us to include them within the actual report coming to committee today, but I wanted to give you an overview of how they performed. So that was 3 of our internal care homes over the course of a week. We had Summerford House was inspected, and Summerford House is one of our intermediate care homes, providing reablement and support for people mainly coming out of hospital to help them regain their confidence and their skills to go home and live at home again. So Summerford scored all 5s, which is very good. We're very pleased with that. Some of the comments in the report were around staff treating people with compassion, dignity and respect. There was very good team working between health and social care staff to support people to achieve their reablement goals. And I think that's really important because it's a really good example of one of our integrated services where we've got NHS and council services working together to support people from a person-centred perspective. We also had an inspection of Thornton Gardens. So Thornton Gardens has transitioned back to providing short break respite service for people. And again, we received all grade 5s, which is very good for the 3 indicators that were assessed. Some of the comments in the report reference the fact that guests were supported during their stay to get out and about. So we try and make this as much as possible as a holiday for the people receiving the services, as well as respite for their carers. Staff worked hard to create a homely environment, and training for staff was obtained prior to any respite stay where it was identified as needed. So really pleased, and I think that reflects very much the leadership and the hard work of all the staff around those services. Grahamston House was also inspected that week. Unfortunately, that wasn't quite as positive as the other two. It did have some really good strengths. So in terms of how well do we support people's well-being, that was graded as a 3, was adequate. However, there was a subgrade of a 5, which is very good for experiencing compassion, dignity and respect. 2 other indicators there were graded as a 3. In terms of how good is our leadership, again, we got good for that, recognising the work, the hard work and the sustained work that's been underway. There is, it was noted that staff treated people with dignity, compassion and respect, but it was noted that improvements were needed around supporting people, particularly with the nutrition and hydration. So we have one requirement and 3 areas for improvement, and the operations manager, Kirsty, who's going to come in a minute. She's doing a lot of work with the teams to put in place the improvements that are necessary, but also to put in place the culture that's required to ensure that those improvements are sustained. There was positive feedback as well. I mean, for example, there was a quote in the report that says that families told us they were happy and there was good communication between them, staff and management. So while there are some areas for improvement and we strive to provide excellent services, overall it is a positive report. I think in terms of through all of the recent inspections we've had in our care homes, there's some common themes that are emerging, and that's around the leadership in particular. So one of the common themes is around our dynamic service improvement plan being in place and having planned actions to drive improvement. There was a common quote that people can be assured that there are systems in place to audit standards of care within the care home, and these included for medication management, nutrition and falls. So I think a lot of that has been down to the leadership, particularly from Kirsty, who's our operations manager, who's been with us earlier this year, and the care home managers really focusing, working clearly with their teams to create that whole team ethos around ongoing improvement, care for people and quality. So I'm going to invite Kirsty in just to give a short outline of the approach that Kirsty's put in place and continuing to embed within those services.
Thank you very much, Gail. And Kirsty, welcome, and if you could give us some comments, that would be useful.
Yes, thank you, Chair. Thanks, Gail. Prior to January this year, there was limited governance and assurance process for our internal care home resources, and this was identified, as Gail said, as a key priority for improvement. So in line with the clinical and care governance framework for integrated health and social care services in Scotland, and also to meet the requirements for the Care Inspectorate framework for care homes for adults and older people, specifically around quality indicator 2, which is the quality assurance and improvement is well led, a new assurance process was implemented. Each home now has a dynamic quality improvement plan, which we share via OneDrive, and this is able to give all parties real-time updates and able to track progress. The new process that we introduced also includes a monthly quality and care assurance report, and it covers the following headlines: health and safety, quality improvement, HR including recruitment and retention, property and repairs. The reports are completed by the registered resource managers and then sent to myself. I then collate these reports into one document, and quarterly this is shared with the locality manager, the chief nurse and the head of integration to provide assurance that the homes are managing risks and we have the correct governance in place. To coincide with this, we also now have a monthly quality and care assurance meeting, which is chaired by myself. All the resource managers are there, health and safety leads, representatives from HR and anybody else who wishes to join or we feel would be beneficial for them to be there. The collated report is discussed at this meeting, and it gives a really good option and time for managers to share lessons and also learn from colleagues. Obviously, the recent care inspection reports will feature very much in those meetings moving forward. The quality and care in our care homes are also considered by the partnerships, clinical and care governance management group. So that's a kind of overview of the quality assurance that's been implemented this year. So happy to answer any questions.
Okay, thank you, Kirsty. Anyone got questions or comments they want to make at the moment? I think I'd like to say, first of all, thank you for this report, and major congratulations to the staff and leadership who have brought forward overall a very good gradings from the inspections. This housing support service has shown the way for everyone else, obviously, proved that it's possible to get an excellent grading, and hopefully some of the others can begin to move towards that. I recently visited Grahamston House, and actually it surprises me that it didn't get a better grading than it has had, because I was incredibly impressed by the dedication of the staff and the leadership in the Grahamston House. So I'm sure it will begin to improve. It's encouraging that some of the other areas where there's been recent changes in the way that the facilities are dealing with things, that they still manage to come up with very good gradings, because often when there's been a change in what you're dealing with, it's difficult to get high gradings at the start. So I think overall, I think we have to commend the staff and the leadership in terms of this. But as is always the case from most of us, there's always ways we can learn and we can do better. So thank you for that, and I'm very glad to hear, Kirsty, from you the ways in which you're beginning to look at this and the ways in which you're beginning to find ways of improving the performance. Any other comments or questions? Yes, thank you very much. So we have now, I think, considered and commented on the content of the report. And we'll move on to the next item on the agenda, which is agenda item 8, the complaints annual report. And I think in this case we have Lynette, I believe, to speak to this. Yes, you're nodding, Lynette. Thank you, and welcome. Welcome to the Community Care Governance Committee.
Thank you, Chair.
So we're not hearing you yet, Lynette. You're not on mute, so I don't know if there's a volume problem. The dreaded headphones.
I apologise.
Yes,
Committee, can you hear me now?
Yes.
Sorry, thank you, Chair.
I don't like them either.
I'm one of the team managers for the social work area of the Health and Social Care Partnership, and this morning I'm presenting on behalf of Gordon Mackenzie, who's on leave today. As committee's aware, there's different complaints procedures and recording systems. The health, one for health, one for social work, and one for the IJB itself, and I'll be presenting on the social work areas of the report, and thanks, Francis, for confirming that you will be taking over the and presenting the health parts of the partnership. Can I also say at the outset of the report that it is laid out following the 9 reporting KPIs that are set by the SPSO, and in my overview comments I'm going to highlight the points that I think may be of particular interest to committee, but obviously happy to respond to questions or comments on any of the other KPIs that I don't mention. I think it's probably most useful. Sorry, did somebody? No.
All right.
Fine.
The technology's not playing well with us this morning.
Okay. Yeah, I think it's probably most useful to start by highlighting that the number of complaints has risen for this reporting period up to 109, and that's up from 67 last year and 57 the year before. However, in the pre-pandemic years, we were sitting at 107 and 114 respectively. So I think rather than seeing the increase this year as being part of a year-on-year trend, I think it may well look like we're actually just returning to our pre-pandemic levels. Within the report, if I could bring you to KPI 1, if I could highlight KPI 1, that's at 4.4 in the report, and that covers the categories of complaints. You'll see for this year that the 3 most commonly used categories for social work adult services complaints are the conduct, treatment and attitude of a member of staff or a contractor operating on our behalf, delay or perceived delay in providing a service, and inadequate quality of service. And I've given a wee bit more detail of what these are about for committee's perusal. We don't have a direct comparison to last year's most common categories since we changed these categories in April 2022, so just at the start of this reporting period, and that was to better align with the SPSO's reporting categories. In my view, though, there's not really a discernible change in the pattern from last year, and we would say for future annual reports we'll now be able to track year on year more accurately if there are changes in patterns, because there's no plans to further change these recording categories. The next area I'd like to touch on is KPI 6. That starts at 4.28 in the report, which covers the outcome of complaints. As an overall picture, from year 2021-22 to this report, there's been a reduction in complaints which are not upheld, and an increase in those that are partially upheld across both stage 1 and stage 2 complaints. And I can give further details if committee would want that. Gordon had let me know when he was handing over for me to present this report that there was a question, and also when preparing the report, I suppose there's a question last year, I believe, from Dr. Heron, who was looking for a bit more detail in this year's report on what the service does following complaints that are upheld or partially upheld. So when looking to respond to Dr. Heron's request, we were a bit limited by the current format of the complaints recording system, which at the stage of completing this report needed a manual scrutiny on a case-by-case basis. This being quite resource intensive, what I've done is I've scrutinised a random sample of the case of 20% of the cases, and that's what I've reported on in the report. In future years, we do hope to be able to increase the sample size, but again, that very much depends on developments from the IT system and on our staffing capacity. But to give a wee bit of a summary and an overview of the actions that we have taken following upheld and partially upheld complaints, that would include things like additional supervision and training for individual members of staff or for teams, discussion within the teams and at team meetings about best practice or improvements to practice, obviously potentially using anonymised examples from complaints, changes to procedures to avoid repeating a mistake or omission, clearly and obviously giving apologies to those that are affected, referring concerns that relate to services that are registered with the Care Inspectorate to the Inspectorate, and in a few cases we've followed our management and disciplinary procedures where that's been necessary. And also to mention, in terms of our other responses to our other complaints, where a complaint's not upheld, for instance, we would provide an explanation to the complainant of the reasons for that we've come to that conclusion, and the details of their option to progress the complaint further if they're still dissatisfied. Finally, the final area from the report I'd want to highlight is the complaints analysis, which is at 5.2 of the report. Again, gathering that the data has been restricted somewhat by the IT system for council complaints, and we would like to be able to provide committee with more of the detail similar to how health systems are able to report. So to that end, I've been doing some work with the council's IT people to try to achieve a reporting that looks more like the data that health has included. That should give us the capacity for future reports to break down complaints on more of a team by team basis and allow us to do some more analysis on based on sorting the complaints through the outcomes or data like that. And I would also mention before I close that future reports we also want to start to include data from care opinion, which was introduced in April of this year and is now featuring in your quarterly reports to committee. That's all the main points that I want to raise from the report. Thank you, Chair. I'd be happy to take any questions either now or after the health data has been reported, whatever suits committee best. Thank you.
I think it might be best to take any questions or comments just now. Well, what you've been saying is uppermost in our minds. So the first thing I would like to say is I'm really pleased to see that David's questions of last year have led to the reporting on the actions taken, because there's no point in having a complaint system unless we learn from it. And we actually implement it. Can I check, does that get fed back to the complainer, the actions that have been taken?
It'll be different on a case by case basis. Obviously, if there's confidentiality in relation to a management action with a member of staff, that wouldn't be fed back in detail. But we would certainly make comment about, you know, we've taken on board the details of your complaint and the necessary action would be taken. Or
I think often the motivation for someone making a complaint is less just to make a complaint than it is to ensure there is improvements for future situations that might arise. And I think we need to make sure that people recognise that we are listening. We do hear what they're saying and we are taking action to ensure that things do improve. Because that is, as I say, the whole purpose of having this procedure and having this reporting. Does anyone else have any other questions or comments? In that case, we'll move on to Francis and the health service section of this.
Thanks very much, Chair. Similar to Lynette, we've got the details for the annual report for up to March 2022. There was a slight reduction in complaints and concerns raised through the delegated health and social care functions, where there are 23 complaints within the NHS system, of which 82% were dealt with within the 20 days. A really, really good response within the partnership in terms of what getting responses back to people who have raised concerns. Number of key areas that were looked at were around clinical management. None of these were upheld, so there wasn't any ability to have any shared learning across the organisation. There were some areas around staff attitude and behaviour, as Lynette has said, that we've picked up individually with staff members, but also looked to see what are the kind of shared learning across the infrastructure, and they mainly related to visiting times and being mindful and noticing family preferences in relation to that. And the final one was around waiting times and appointments, and none of those were upheld. So in essence, a really good performance by the Health and Social Care Partnership in relation to NHS complaints and concerns, and I'm happy to take any questions.
Thank you, Francis. Does anyone have any questions or comments on the health sections there? Can I just, oh, sorry, David, yes.
Thank you for trying to provide a bit of context there, Lynette. I think in both reports there was complaints from the public around waiting times, and it sounds like none of them were upheld. Can you provide any more kind of feedback around that? Is it because the public's expectation is different to what standards we set, or, you know, it sounds like there are complaints coming in, but they're not upheld, so be interested in that. Thanks.
And Lynette, you want to answer that one?
certainly that's something that we had a look at when I was discussing the report with Gordon, and we do have some that are upheld and partially upheld in relation to delays, because we can understand that with the pressures on the service, we are not necessarily able to respond to all people's referrals and requests in the timescales we would like to. The service has to prioritise the instances where people are at the highest risk and with the greatest level of need. So that's things like our obviously our adult support and protection cases, instances where there's a potential for carer breakdown, and those that are experiencing what we would assess as a lower level of risk or a lower need for immediate intervention would be seen. It would take a bit longer for us to get to see these staff, and that's the pressures on the system, as it's well documented. The pressures for recruitment and retention of staff across health and social care, and we're no different here in the Falkirk area. But certainly, yeah, that's some of the reporting that we'd like to do in a more nuanced way to be able to tell committee what types of complaints are upheld. But I think maybe Francis has got more picture on that from the health side, but that's certainly the social work side. And this, Martin or Patricia, would you want to add anything to that?
I think I'm seeing shaking heads to that one, but Frances had her hand up about the health side things. Yes.
Yeah, David, thanks very much for the question. I suppose the concerns that were raised that were not upheld related to unacceptable waits for appointments, and those would be in line with the waiting times rules that we would apply in terms of date order and all of that good governance process that we've got in place there. And I think there's a recognition across, not just within the Health and Social Care Partnership, but wider that there are some waits that are out with, although NHS Forth Valley's waiting time performance is particularly good in comparison to other health boards in relation to waiting times, but those were not upheld on that basis.
Thank you. I guess as Councillor Hannah said, it's important that we hear the voice of the public, and the voice here is the public saying we don't want to have to wait as long as we're having to wait. And I appreciate, for all the reasons you've said, absolutely people have to wait a long time for appointments. You know, the waiting time for outpatient appointments in Forth Valley is a long time, and it's a problem for our patients. But so we need to make sure we hear that voice, even though their complaint is maybe not upheld. I think we just need to make sure that we hear that voice. So thank you.
Thank you for that, David. I think I have to kind of back that up. As a councillor, I get complaints on a regular basis about the time people have to wait for these things, and I think we have to, while in the individual situations you've dealt with as formal complaints, it may not have been upheld, may not have been out with our standards. We do have to learn from the fact that people are saying that. We do have to learn and look at the ways in which we can improve our structures. I recognise that staffing constraints are a problem, both in the NHS and in social care area. So, but we need to do all we can to resolve that and look at systems that ensure waiting times are minimised in all situations for non-priority as well as priority situations. Margot, yes.
Just to say, I think there's a communication issue here as well, and it's one of the sort of major causes of complaint, and part of it is caused by people not knowing about how primary care in particular has been reorganised, and that there are people that you could see more quickly because they're more appropriate. And I feel more could be done to share with patients in all categories routes that they can take. I don't mean going private or anything, just going to see perhaps a physiotherapist, or, you know, things like that, I think would be important. Maybe just, if not a face-to-face consultation, an explanation about how you could tackle the problem.
I think that's a really important point, Margot. And it is something that I'm aware there have been changes in the way primary care operates. And funnily enough, I was just pointing out to somebody 2 days ago who was complaining about a wait for an appointment, that it was possible to directly ask for a physiotherapy appointment, and that might be preferred. It might actually answer. And I think we do have to make sure that we have the right people making the responses, and where people are having to wait for the appointment they've asked for, perhaps a bit more communication about the alternatives.
Thank you.
Thank you very much, Margot. That's a really good point. David, you want to come back in on that point?
Sorry, yeah, and I guess potentially I'm straying off the topic slightly, but yeah, Margot, I mean, the physio, as you mentioned, the example of the physio, the access to that is still via the GP practice. So you still phone the GP practice. It's just you would expect the receptionist to direct you to an appointment with an advanced physio practitioner rather than with a GP. I think we can explore the direct routes into other healthcare out with general practice, you know, dentists, opticians, pharmacists. You know, we're really looking for other routes of direct access to healthcare that isn't through the GP practice, but certainly, you know, I think we have had videos and things that explain these services out on the internet. We could maybe do more to raise the profile of them via the Facebook pages and such like, but for physios and mental health nurses and ANPs, you still access them by calling your GP practice. So it's still essentially the same route at the beginning. Right.
Thank you.
Thank you for clarifying that, David. I apologise if I was a bit misleading there. Any other comments or questions? Okay, well, thank you very much for this report, and we have clearly considered and commented on it. So that would take us on to agenda item 9, which is still the same subject, but looking at the more recent feedback performance for April to June 2023. It's nice to see us catching up. So once again, I think we are with you, Lynette, first, then Francis.
Perfect, thank you, Chair. Going through the, as with the annual report, obviously I'm presenting on behalf of Gordon, and it'll be the social work areas. And just to mention, there were nil complaints in regard to the IJB complaints reporting process for that quarter. So it's just myself and Francis. The areas that I would like to highlight for committee, first off is a response performance. And I would, as committee will see, although slightly down for stage 1 complaints in quarter 1 of this year compared to quarter 4 of last year, we are still in a position of marked improvement since quarters 2 and 3 of the previous reporting year. Management action in relation to complaints is continuing with the aim of maintaining progress already made and seeking to get the figure to consistently above 70%. So that's kind of main comment about our response timescales. I would also mention the care opinion system that's mentioned near the end of the report. It was reduced at the start. It was introduced, sorry, not reduced, at the start of the quarter, and that's a joint system that covers both the social work and the health services within the partnership. And we can see from the numbers that people are starting to post their feedback on the site, just in small numbers. Teams are continuing to let people know, resettlement teams and social work are continuing to let people know about care opinion using the materials that Care Opinion the care opinion team have provided to us. So we've got postcards and leaflets that services have out into to hand. A working group for care opinion has been established. And we'll be looking to build on for future reports. We'll be looking to build on how we can use the data from the care opinion system to the best effect, so that we can report the detail from that to the committee. That system is so that people can report make direct comments, which could be both positive or negative comments. So we'll be looking in more detail at that with my colleague and Suzanne's team, who has access to the nuts and bolts of the care opinion system. That's the main points that I do want to raise, because most have been covered. We've been talking about them in the annual report, but if there's questions on the social work side of the quarterly report, I'm happy to take these, Chair.
Is there any questions or comments? Or shall we go on and ask Francis now to cover? Oh, sorry, Margot, yes.
Just to say, I can't commend care opinion as part of the process enough, because people feel that at least they're being taken seriously and that they are going to receive a well investigated response. And from your end of things, I think it will prevent a lot of complaints being progressed to a formal level. Not that that's something we should be aiming for if it's not appropriate, but I think it's really something that improves the patient and carer satisfaction with actually making a concern known.
Thank you for that, Margot. Yes, I think it is important as we go forward, and it's also important that it's well advertised so that people can be encouraged to use it. So thank you for that. Francis, would you like to come on to the health side?
Yes, thanks very much, Chair. So in terms of the picture for the first quarter, it's a less positive picture in terms of response. The numbers of complaints are 12 in total, of which 3 are stage 1s, which were complied to within 100% within the 5 days, and 9 stage 2 complaints, which the compliance rate was 22%, which is pretty low in perspective. I made reference at the start of the meeting that Ailey Gallagher, who's recently been appointed as the Head of Person-Centred Care for NHS Forth Valley, came into post on Monday of this week, and Ailey and I met earlier in the week, and Ailey is working with all of the areas, including the Health and Social Care Partnerships, to look at the processes for complaint responses to stage 2 complaints, and also working to make sure that we refine and modify those to meet those response times, as well as tracking and sharing activity data and compliance data on a regular basis with those responsible in those areas. So there's a lot of work to do in that space, so not just within the Health and Social Care Partnership, but across the system within NHS Forth Valley, which Ailey and her team will make great pains to try to deliver improvements in that space. We also saw some positive results coming through in terms of the care opinion data as well, as Lynette and her colleagues, so I think really positive. One of the areas that I want to pick up, that Ailey and the team will pick up, is the number of not upheld complaints in particular. It looks to me to be higher than I would have anticipated, so we will pay particular attention to that not upheld space, just to make sure that we're landing that absolutely as you would expect. So I think happy to take any questions from committee members, and we will watch that progress against that compliance, hopefully improve with a bit of detailed contribution from Ailey and the team. Thank you.
I'd like to welcome Ailey to the fold, and look forward to, I won't put you on the spot to give us any comment, but just welcome you and look forward to hearing you at a future meeting when you've had time to get your feet under the table, and more importantly, had time to make some improvements, which I'm sure you will. Does anyone have any questions or comments? I'm just glad to hear you're looking at the not upheld area. It's on the one hand, it could be a good thing. On the other hand, it could be giving us a different message altogether when there's a change like that. So it's important that it is looked into. Anyone else? Any comments or questions? In which case, thank you. We have considered the report and commented, and we can move on now to agenda item 10, which is the Clinical and Care Governance Committee governance, which is a lovely title. So I'll leave you to explain what that is, Suzanne.
Thank you again, Chair. The report provides an update on governance matters relevant to committee. So committee will be aware of its clinical and care governance framework in terms of reference, which sets out the arrangements in place to assure the integration joint board, Falkirk Council and NHS Forth Valley on the quality and safety of its health and social care services that are being delivered. These require review, and committee has received previous reports regarding this. And committee has been asked today to note that this work will be done alongside the review of the integration scheme and the due diligence work on the transfer of the Pan Forth Valley NHS services to the two IJVs and partnerships. This will ensure the work will also be progressed in line with our annual internal audit report, and that was presented to Audit Committee on the 6th of June this year. A report will be provided to a future committee meeting once this work has been concluded, but in the meantime, committee is asked to approve the current terms of reference on an interim basis, as this is an annual requirement. The terms of reference also require a review of membership and chairing arrangements, and there are no proposed changes to the membership, and Councillor Hannah and Stephen McAllister have indicated they wish to continue as chair and vice chair respectively. So in conclusion, committee is asked to approve the recommendations set out at 2.1 to 2.3 of the report, and happy to take any questions.
Okay, thank you, Suzanne. If someone else wants to chair, they'd be more than welcome, but I'm very happy to continue as chair of this committee. Does anyone have any questions or comments? No? Oh, that lets us move on then. So thank you, Suzanne, for that. We can move on now to agenda item 11, the last item on the agenda. And I think you're going to lead on that, David?
Yes, thank you, Chair. So this report we received regularly to committee, and it provides an overview of any national publications of relevance to the Health and Social Care Partnership. This time around we have 5 reports, 4 of which are from the Scottish Government and 1 from the Mental Welfare Commission. The first report we have the Realistic Medicine Doing the Right Thing report, and this is a part of the annual report prepared by the Chief Medical Officer. And it reflects on the challenges in the system is facing and the challenges that care providers and professionals deal with every day. And it asks care providers and professionals to practice realistic medicine in order to deliver the best value care through reducing harm and waste and reducing health inequalities and contributing to climate change. The report contains the 4 main chapters on being human, value-based health and care, principles for action, health inequalities, and climate and health. The next report is the Mental Health and Wellbeing Strategy. So this is a strategy from the Scottish Government which sets out the Government's long-term vision and approach to improving mental health and wellbeing of everyone in Scotland. The strategy acknowledges that there's some way to go, but this paper describes what the Government thinks is a highly effective and well-functioning mental health system and what that should look like. The strategy also covers all areas of need, from maintaining good mental health and wellbeing to support available within the communities, and to recognise and respond to many of the underlying social detriments, circumstances and inequalities that can affect people's mental health and wellbeing. In this report, we've also included a local update, as you see at 4.5. So the Falkirk Community Planning Partnership received an update in relation to current activity taking place locally in relation to its theme-free mental health and wellbeing of the Falkirk plan, and you can find a detail of that at Appendix 1. At 4.6, we have the Caring, Compassionate and Human Rights Informed Drug Policy for Scotland. This was released a few months ago, and it outlines Scottish Government's vision for a drug policy in Scotland and calls for change to the legal framework within which Scotland responds to drug-related deaths. And it provides an overview of drug-related deaths in Scotland and argues for further devolution of drug laws to Scotland. And it sets out the Scottish Government's vision for what a drug policy should look like for the country, to take a harm reductionist approach to drug use. And one of the key recommendations of the paper is the call for the decriminalisation of drugs for personal use. But as we're aware, this is a reserved matter to the UK Parliament. At 4.7, we have the investigation into the care and treatment of AB, and this is an investigation into the circumstances leading up to the death of an individual, AB, with a moderate learning disability, whose death occurred shortly after detention under the Mental Health Act. It was revoked. The report presents the Mental Welfare Commission's findings across several areas of investigation, and it includes 11 points which are not formal recommendations to be taken into consideration. In addition, there's 6 formal recommendations that have been made directly to NHSA and local authorities specified in the report. And this report is going to be considered by the Case Review Working Group at their October meeting, with report to the Adult Protection Committee meeting in November with any recommendations for local action. And I think last but not least is the Care in the Digital Age Delivery Plan for 2023-24. And this plan sets out a range of digital and technology-based initiatives to give citizens greater access to and control over their information, tools and services to help maintain and improve their health and well-being. This is the first Care and Digital Age Delivery Plan was published in November 2022 and is updated on an annual basis, and the refreshed plan for 23-24 describes activities underway that support local health boards, health and social care partnerships and local authorities, primary care, social work and care providers to offer new or improved services with better systems, infrastructure and improve access to digital services and products. We've got a Falkirk HSCP Digital Health and Care Programme Board has been established to bring together digital health and care projects and expertise to support and progress the technology initiatives within the partnership. And you can see at 4.12 and 4.13 there's just a summary of the ongoing work locally. And that is me, Chair, and I'll go back to you for the recommendations. Thank you very much.
Thank you very much, David. I really appreciate this report and the summaries of some of the documents, which much though I would love to read them all in detail, it's not always possible, so it's really useful to get the key points highlighted. Does anyone have any questions or comment? Oh, sorry, the other thing I'd say, it's also really useful to have the local situation, particularly related to the Falkirk Community Planning Partnership, to see how that is brought to bear in terms of the local area. So I think that's really, really useful as well. Anyone else got any comments or questions? If not, I will say that we have considered and commented on the content of this report, and that I think is the final item on the agenda. So I'll say thank you very much to all, and I look forward to hearing from some of the new faces at future meetings. And I hope we've managed to let you get away in time for your next meeting, Francis. So thank you very much to one and all.
Thank you, Chair. Thank you, Chair.
Thank you.
Thank you, Chair. Thank you.